Hello, welcome back. Today in this video, we are going to start with another important section, that is basic topics in medical science. And under this topic, we are going to discuss a few important subtopics. And especially in this video, we are going to discuss the stomas. What are stomas? What are the uses or indications of a stomas? What are the different common stomas we are using practically, and how they are useful? So let's start with what is a stoma. The stoma is basically, this is used for any organ that is having a lumen inside, a hollow viscous organ. And whenever we want to divert the content of that particular organ, we use these stomas. So we can define it like this is an external opening in an organ having a lumen, and that external opening is over the anterior abdominal wall. These stomas could be temporary or permanent. Temporary stomas means we have made an opening for, let's say, 6 weeks or 3 months, sometimes for longer duration, depending on the disease process or natural history of the disease. And later on, we are going to close it. Permanent stomas means we have already removed the distal segment, the distal part of the GI tract, especially in cases of malignancies. And now this opening is on permanent basis. That will be there. What are the different types of stomas? These are the 5 common types we are practically using. And I have mentioned them in a chronological order for easy concept or easy understanding. Starting from the stomach, then jejunum, then ileum, then this colostomy means colon, related to colon, and then finally in procedures over the urinary bladder or lower urinary tract, this is another important stoma, that is urostomy. So 5 important types: gastrostomy, jejunostomy, ileostomy, colostomy, and urostomy. And these procedures, the operations procedures, I have already explained in another video how to document any operative procedure. Gastrostomy, gastro means stomach, ostomy making an opening in the stomach. Similarly, you can go through that video. The gastrostomy, jejunostomy, ileostomy, colostomy, and urostomy. One by one, we'll cover. First of all, the gastrostomy. Gastrostomy means there is a connection we have structure. That connection is in between anterior stomach wall and anterior abdominal wall. We have established a connection between these two structures, the anterior stomach wall and anterior abdominal wall. This is gastrostomy. How can we create it? Either we can create it by open surgery during exploratory laparotomy, or a small incision over the subcostal area, By open technique, we can do gastrostomy, and sometimes in very debilitated patient or unconscious patients, there is a procedure known as PEG, the endoscopic way of doing gastrostomy. PEG is percutaneous endoscopic gastrostomy, right? So we can do it either by open technique or by endoscopy method. Why it is done? Two purposes basically. Whenever we want to drain the stomach, that is a requirement of any operative procedure. And second, whenever we want to feed the patient, direct feeding, for direct feeding purpose, we go for this gastrostomy, right? Now the second one is Jejunostomy. It is a connection between the two structures. Always there is a communication between two structures. In this Jejunostomy, the proximal jejunum and anterior abdominal wall, these two structures are interconnected. The proximal jejunum and anterior abdominal wall. Again, we can create it by open surgery, and if facility is available, even by endoscopic route, and if expertise is available, yes, we can go for laparoscopic method also. I hope you all know the difference between endoscopic and laparoscopic. Endoscopic, whenever we are going inside the lumen of any organ and then we are performing any procedure. Laparoscopic means we are going inside the peritoneal cavity and we are just performing any procedure through the peritoneal cavity, right? What is the use of this jejunostomy? Most commonly it is being performed for, again, feeding purpose, the nutrition, to improve the nutrition of the patient, direct feeding, right? The ileostomy, most commonly performed among all these types, and it is, there is connection between the any part of mid or distal small bowel, mid or distal ileum, and anterior abdominal wall. So mid or distal small bowel and anterior abdominal wall is interconnected. In all these things, the one common thing is anterior abdominal wall, right? Again, it can be created by either open surgery or laparoscopic route. After doing diagnostic laparoscopy, if it is required, we can do it by laparoscopic route also. What is the use of doing this ileostomy? Obviously, GI drainage. Whenever we want to drain the GI system, gastrointestinal system, this is an option, ileostomy. To be more specific, there are two types of ileostomy most commonly performed, the loop ileostomy or end ileostomy. There are other classification, but just remember these two types, loop ileostomy and end ileostomy. Loop ileostomy is usually done whenever we want to give the rest to the distal bowel during the course of illness. Whenever we want to give the rest to the distal bowel, then what is the option? Loop ileostomy. And whenever any disease process is running and through the during the management of that disease process, we have removed distal bowel surgically and there is no distal segment available, then end ileostomy can be an option instead of loop ileostomy, right? This is an example of loop ileostomy. You can see two loops are there. This spouted appearance. In the right side of the abdomen, this is the midline incision. This one is caudal end and this one is cranial end of the patient. This is abdominal drain and this is right side of the midline, right? Loop ileostomy. Then comes a colostomy. The connection is in between any part of large bowel and anterior abdominal wall. Again, we can create it by either open surgery, open technique, or by laparoscopic route. The same thing use is GI drainage, and similar to the ileostomy, two varieties, loop colostomy and end colostomy. Whenever we want to give the rest to the distal bowel means the part of GI tract that is situated distally to this opening. This is stoma, right? So loop colostomy is done whenever we want to give the rest to the distal bowel. And colostomy is preferable whenever there is absence of distal segment. We have already removed it surgically as a part of disease management. Okay. And the final one is the urostomy. Urostomy is basically there is a procedure where there is connection between a short length of disconnected ileum into which one or both ureters we have diverted, and we have joined this disconnected ileum opening with the anterior abdominal wall. This is known as urostomy. Disconnected ileum means we have separated a part of ileum with its blood supply, and we have transformed this into a reservoir. Over this reservoir, we have diverted either one or both ureters as per the requirement, and now the opening of the reservoir, we are just connecting it with the anterior abdominal wall, hence urostomy. We can create it either by open surgery or laparoscopic route, and in few centers, yes, robotic surgery can also be used for this purpose. And what is the use of this urostomy? Drainage of urinary tract. After radical lower urinary tract surgeries, whenever we are performing some extensive surgery over urinary bladder or prostate, sometimes involving the urinary bladder, the malignancies usually, or sometimes in severe trauma where there is inability to save the bladder or the lower urinary tract, then this is an option for diversion, right? Urostomy, when we want to drain the urinary tract. But how to identify? How to identify which opening is what? So these are the typical features that can help us in identifying the stomas. One by one, very basic points I'm discussing. The gastrostomies and jejunostomies, both the things, gastrostomies and jejunostomies, opening in the stomach, opening in the jejunum, right? So these two gastrostomies and jejunostomies, they are usually narrow caliber is there, narrow opening, right? Usually the opening is flush type. What we have just seen, that was spouted type. Flush type means almost just at the level of the anterior abdominal wall, not coming out. The flush type with little visible mucosa of the stomach or jejunum. Usually the most common site is left upper quadrant of the abdomen for gastrostomy and jejunostomy. And these two openings, they are usually fitted with indwelling tubes or access devices, right, for proper management. Then comes the ileostomies, either loop or end, and the opening is usually spouted, and there are prominent mucosal folds, what we have just seen in the previous picture in this video, and the color is usually dark pink or red, usually situated on the right side of the abdomen, usually. So most common site of ileostomies are right side of the abdomen, and they are usually fitted with external kits, ileostomy kit, right? Then comes the colostomies. The loop or end again The opening is usually flush type, as was in the gastrostomy and jejunostomy, with flat mucosal folds. The color is usually light pink. Most of the time, the colostomies, they are situated over the left side of abdomen, most common site. Again, they are usually fitted with external kits, right? And finally, the urostomies, especially basically the end urostomy. We have already removed the distal part, and usually the opening is usually spouted, as was seen in ileostomy. Why? Because again, urostomy, that is containing a disconnected part of ileum, the small bowel. So spouted opening is there, right? Anything that is associated with the small intestine, that opening is supposed to have spouted end, right? Then prominent mucosal folds are there. The color is usually dark pink or red, and similar to the ileostomy, the most common site is right side of the abdomen. This is also usually fitted with the external kits. The important thing here is it is very difficult to differentiate between end ileostomy and urostomy unless we are going to see the content of the output, whether that is urine or intestinal mixed content, right? So it is very difficult. It is very important to differentiate between the urostomy and ileostomy. Most of the things are almost same. So the only important thing is the content of the urostomy and ileostomy will differentiate between the two. If urostomy, urine will be there, and along with the intestinal mixed content, and in cases of ileostomy, only the intestinal content will be there, the liquid stool, right? So just to summarize, the difference between these two as per the site is concerned, the right side abdomen, ileostomy and urostomy. In both these procedures, the small bowel is being used, the ileostomy, right? And on the left side, the gastrostomy and jejunostomy, along with colostomy. All these three, they are usually seen over the left side of the abdomen. The opening stoma is usually spouted type in ileostomy and urostomy, and flush type in gastrostomy, jejunostomy, and colostomy. The devices or kits used, usually the external devices are applied over the ileostomy, urostomy, and colostomy, whereas the indwelling devices may be usually present or access points are usually seen in cases of gastrostomy and jejunostomy, right? Means that indwelling catheter can go inside the stomach, can be present inside the jejunal lumen. That means indwelling, right? Gastrostomy and jejunostomy. Whereas in external devices means only we are applying the kit over the anterior abdominal wall surface, the ileostomy, urostomy, and colostomy. Clear? So that is all for this video. And if it is useful according to you, subscribe it, like, and share to promote the learning. Thank you and namaste.